Hello to everyone. My name is Dr. Katrina Tsvitkova. I was born in Kiev, capital of Ukraine, and I graduated from Medical University in Kiev. And I also have got 30 years of medical and research experience in the Research Center of Obstetrics, Pediatrics and Gynecology. I've got also PhD in children pulmonology. I am also registered as homeopath internationally in South Africa and in Ukraine. Being a very much conventional doctor, I was also interested in a different kind of holistic therapy. One of the most interesting thing for me was to learn different kind of breathing exercises. And the most interesting technique I found was the breathing exercises that was introduced by Strelnikova, Russian singer, who was doing breathing exercises to prevent a lot of illnesses like bronchial asthma, obstructive bronchitis, arteriosclerosis, and a lot of others. I did particularly like these exercises by Russian singer Strelnikova because it can expand our lungs and push maximum amount of oxygen in our tissue. So I started to develop it further and put these breathing exercises into a specific structure of physical exercises that I called Vital Energy Diaphragmatic Breathing Technique. The benefits of this technique is enormous. First of all, it can prevent or alleviate any kind of symptoms of viral infection, including COVID-19, as while you're doing it, you control the immune protection in your nostrils and in upper respiratory tract. Secondary, these exercises can improve your metabolism and it can bring the cholesterol level, sugar level, and the triglycerides level to a normal amount in our bloodstream. Thirdly, because you're doing a lot of stretching exercises, it can control the activity of our joints and it can prevent any kind of a stiffness or inflammation in them. These exercises, particularly, do not have any kind of hyperventilation, any increase in the pulse rate, and has no muscular cramps. When you do it correctly, you feel so elevated, so lifted, so happy, and so strong after them. When you do these exercises every day, you feel much stronger, much happier, with less of cellulite, with less of memory loss, and even aging process. So when you particularly do this breathing technique, you do not produce any hyperventilation, any muscular cramp, any high pulse rate. To fulfill these exercises, you need 4 things. You need a little bit of a patience, you need a little bit of a space, you need 2 chairs, and you need to have a little bit of time. So when you do these exercises, it's very important to remember to do it correctly. So because of that, and it's a very difficult technique for somebody who is suffering from bronchial asthma and other metabolic and other medical conditions, my presentation on breathing exercises will be consisting of 4 parts. The first one is a theoretical part, as you can and you have to understand how these breathing exercises can improve your metabolism, can improve your immune activity, and how you need to involve correctly your diaphragm. The second part will be the correct diaphragmatic breathing. The third part will be our exercises, and we will learn from one to another how to do it correctly and how to involve diaphragm in a maximum way to expand our lungs and to get maximum amount of oxygen to our tissue. And the fourth one will be about prevention of flu. So what do you need to do with this breathing? How you need to breathe when you're having first attack of viral infection or you've been exposed to viral infection somewhere. Now we start with theoretical part. To understand correctly how diaphragm works and which mechanisms are responsible for the penetration of air into our lungs, we have to understand the physiology of breathing. First of all, to provide inhale, we need to put some energy into it. To do the work, we need a muscle or muscles that can provide it for us. There is a lot of muscles that we call muscles involved in breathing. However, only one with the name diaphragm is considered as a muscle that provides physiological inhale. It has a shape of an arch, a dome, and while it constricts, it becomes flatter and general pressure in the chest decreases. That gives a possibility for the lungs to expand. Oppositely to the chest, the pressure in the abdomen area increases as the volume of it becomes smaller. To expand efficiently the lungs, the diaphragm needs to be very strong and trained, as it has to overcome the impedance of respiratory system. When we breathe quietly, the diaphragm becomes only one active muscle to provide the inhale. As we're making different kind of exercises, such as running, jogging, jumping, or in emotional stress, or in medical conditions that restrict the activity of diaphragm, like bronchial asthma, bronchitis, pneumonia, obesity, or even sitting job, we need to involve additional muscles to inhale to minimize hyperventilation due to the necessity of a bigger amount of oxygen to our skeletal muscles and internal organs. We call them additional respiratory muscles, and they are mainly intracostal, sternocleidomastoidus, abdominal, and some others. If we are healthy, the exhale is passive. However, in hyperventilation, we also involve additional muscles into it, like intracostal, abdominal, and even muscles of vocal cords. When the additional muscles are involved in breathing, the activity of diaphragm slowly decreases and it becomes more flatter with a less strong constriction. Flattering of a diaphragm with the loss of its muscular activity causes immediate decrease in the respiratory volume of the lungs and gradually leads to oxygen deficiency in our body. In this particular case, people develop so-called chest type of breathing, as upper parts of our lungs start to be involved in ventilation and oxygen supply. And the problem is, upper part of our lungs physiologically are having much lower activity of alveolar blood circulation and of course oxygen penetration into capillaries and then to our cells. Vice versa, the breathing by the main inhaling muscle, diaphragm, we call abdominal type of breathing. That involves only lower part of our lungs into the process of inhaling, where the activity of blood circulation around alveolus is much higher compared to the upper part of our lungs, and of course higher oxygen supply to our internal organs and muscles. If you look at our diaphragm that separates chest and abdomen part of our body from inside, you will see a lot of communication areas. First of all, the main artery of our body with the name aorta goes through it and brings oxygenated blood to all our internal organs and muscles. Very close to aorta is ductus thoracicus. It's situated just near, and it goes through the same window as aorta. As it goes through the aorta window of the diaphragm, it forms cisterna ilia, a reservoir of lymph from the lower extremities, right and left, internal organs of abdomen and pelvic area. Another big window is formed for the main vein of our body with the name interior vena cava that brings low in oxygen blood from pelvic and abdomen area and our extremities. By diaphragmatic breathing exercises, we intensify the flow of lymph and blood through our system. The diaphragm works as a pump to speed up the flow of lymph and blood, to oxygenate, speed up our metabolism and tissue regeneration, and also for better detoxification and immune control of our body. Another big window of our diaphragm is for the esophagus. It is very important to know where this window is situated, as it can play a role in appearance of secondary hiatus hernia. It happens with the sudden development of heartburn when our diaphragm is not trained enough and also has weakness in its ligament system. A part of incredible strong increase in flow of blood and lymph through the main vessels, the vital energy diaphragmatic breathing technique will provide the massage of liver, gallbladder, intestines, kidneys, and very importantly, adrenal glands. So no surprise you feel so lifted, happy, and rested after making these exercises. A part of stimulation of the activity of a diaphragm, these complex of breathing exercises are assisting in normalization of inhalation through the nose passages. To understand how inhalation through the nose works, we have to understand the anatomic and physiologic structure of the upper respiratory tract. Respiratory part of mucous membranes of our nose consist of one layer of specific epithelium covered with vibratory cilia or lashes that's supposed to move only in one direction, from the tip of our nose towards our throat. Why? It is because in between these epithelium cells, you can find another kind of cells, so-called goblet cells, as they have a shape of a wine glass. The main role of these cells is the production of mucus, with the Latin name mucin. When goblet cells are full of mucus, they break out and the mucus comes to the surface of the nasal epithelium, and the role of these mucus is very important. Everybody who is healthy produces approximately 100 milliliters of it in 24 hours. The main role of it is to protect nose epithelium from viral and bacterial invasion. Mucin by itself is very sticky and equally allocates through the nose epithelium. However, mucin has two layers. One is a surface layer, another is internal layer. The surface layer or protective layer is very concentrated and can stick any viruses, any bacterials, any pollen, and any pollution onto it, restricting their movement and penetration inside of the nasal epithelium. Internal surface of the mucous layer is oppositely very thin, and because of that can provide active movement of the mucus by cilia down to our throat. At the end, we can swallow the mucus or cough it out. Approximately the same structure of epithelium we have in our lungs passages, however, with opposite direction of cilia movement, from inside of our lungs towards our throat. And at the end again, you can cough the mucus out or swallow it. This process is called mucociliary clearance, and it is one of the most general and important mechanisms of the protection of our respiratory system from the pollution, pollen, bacteria, and any viruses, including COVID-19. The Vital Energy Diaphragmatic Breathing Technique that you're going to learn today are definitely a strong prophylactic measure, especially in an epidemic viral situation, including COVID-19. These exercises being developed gradually with a lot of love and care, with the main idea to protect our body from respiratory infections, to control our metabolism and our blood pressure, to activate our muscles, and to bring up our emotional and intellectual strengths, and to reduce the aging process. Now, when the theoretical part is over, we're going to learn how to do the most efficient diaphragmatic breathing with the name Vital Energy Diaphragmatic Breathing Technique to support our health. And now, when theoretical part is finished, we're slowly going to another part where you have to learn how to breathe correctly. So we will do correct breathing in our Vital Energy Diaphragmatic Breathing Technique. To understand how to breathe correctly in this technique, you need to know 5 rules. The first rule is how you breathe through your nose. You breathe in, or you inhale through your nose, and you exhale through your mouth. So keep your mouth open all the time, not to waste your time to close and to open your mouth. And the inhale needs to be very strong, very loud, very short, and the exhale, oppositely, needs to be quiet and also very short. To do it easier, and to do it in an easier way, you can pronounce the letter K. You just remember, my name is Katrina, so you pronounce the first letter of my name, and that's your exhale. K, 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 k. So I will show how I do inhale, how I do exhale. Just remember, to inhale, you do it strongly, you do it in a short way, and you do it very loudly. To exhale, you have to open your mouth, and you do it shortly, quietly, by sound k, 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 k. That's your exhale. Another rule, keep your shoulders down, as you have to control the penetration of oxygen to the upper part of your lungs. You cannot do that because we're going to do abdominal type of breathing. So keep your shoulders as down as possible, and you will be successful in a breathing with your lower part of your lungs. The third rule is how you keep your legs. Your legs need to be aligned to your shoulders, and your toes need to be pointed inwards, and then you do it for the stability to actually do all our exercises. It is the rule number 3. The rule number 4, you have to do all the exercises on empty stomach. It is very necessary not to have overstretched stomach because you're doing breathing exercises. The rule number 5, when you do inhaling, your diaphragm constricts, and then your pressure in your abdomen area goes much, much higher, and all your internal organs in your tummy go out. And then when you exhale, your tummy goes backwards. This is the rule number 5. Now we move to the third part of my presentation, and we will learn how do we need to do all our exercises. Just in the beginning, I want to tell you that I divided them in 2 big groups. The first group of exercises I called aerobic exercises. Why? Because you will have enough of oxygen and you will not produce any hyperventilation, any increase in the pulse rate, and you will do it with a lot of pleasure, very easy way, and you will not feel any kind of tiredness. They are called aerobic exercises, and it's only 14 of them. Another part of my exercises will be anaerobic exercises. These anaerobic exercises will be very intensive. You will have a little bit of a hyperventilation. Your pulse rate will go up, but not more than 140 beats in 1 minute, and you can develop a little bit of a muscular cramp, but you do it to increase your metabolism, to lower down your sugar level, your cholesterol level, and to get rid of triglycerides, of a storage of triglycerides in your liver and in your adipocytes. In the next part of my presentation, let me introduce you to my student, Doreen Nell, and we will do all the exercises together. At the beginning, let us start breathing correctly. Let us start to learn how to breathe correctly. So what we will do, you will remember, you have to stay and your legs need to be aligned to your shoulders and your toes need to be a little bit pointed inwards. And then what you do, you put 2 of your hands on your tummy to feel when your diaphragm constricts, and you have to see your tummy that on inhale needs to be out. Keep your shoulders down, keep your mouth open, and breathe nicely, strongly through your nose, and breathe out through your mouth. Just remember, inhale goes through your nose, exhale goes through your mouth. Keep your mouth open and keep your shoulders down to exclude the upper part of the lungs from breathing. We put 2 of our hands on our tummy, and while I inhale, I can see that my tummy goes out. After inhale, I exhale immediately with a sound K. Let's do it. Just remember, you don't need to have any kind of hyperventilation. You cannot go short of breath. Why? Because you pour such a lot of oxygen into your tissue that practically and theoretically you cannot produce any kind of hyperventilation. Now we move to another part of our presentation, and it will be how to do all the exercises. So the exercise number 1. Now you keep your hand, one of your hands on your tummy, and with another hand you close with the index finger one of your nostrils. You close it and you try to breathe through the open nostril, and while you do inhale, your tummy goes up. When you do exhale, your tummy goes in. So let's repeat it. Good. And now you change your hands. You close another nostril with the index finger. You put another hand on your tummy and you breathe with the open nostril. The exercise number 2 is very easy. So you stay in the same position, your toes are a little bit pointed inwards and your legs are aligned with your shoulders, and you have to close your chest. Just remember, lift your arms, and you have to have 90 degrees angle here, and you have to have a very intensive inhale while you're closing your chest. So when you close your chest, you inhale and you exclude the upper part of your lungs from breathing, and while this technique, you are making the constriction of diaphragm much easier. So you close your chest, you do inhale, you open your chest, you exhale with a sound k. Let's start. Thank you. Just remember, when you do exercises, it's aerobic exercises. There should be no hyperventilation at all, and your pulse rate needs to be as usually when you are in a relaxed condition. Aerobic exercise number 3 is a little bit more complex. You stay in the same position, your legs are aligned to your shoulders, your toes are a little bit pointed inwards, and you go on your toes, you lift up your heels, and you bend your knee, and your body goes backwards. When you do that, you do close your chest in a maximum way. You close your chest and you do inhale. When you open your chest, you exhale. Just remember to keep your face down. You have to look onto the floor all the time for the stability, not to lose your balance. So let's start. Now it will be exercise number 4. It's a combination of the second one and the third one. And you can do it differently, but I prefer you will do it in our way. So when you do the second one, you close your chest, you inhale, and then you exhale when you open your chest, and you don't bend your knees. When you do a third exercise, you actually go backwards, you look onto the floor, you close your chest, you bend your knees, you go on your toes, you lift your heels, and you inhale when you close your chest, and you do exhale when you open your chest a little bit. In case it's difficult, I will show you how to do it in an easy way. But first of all, I want us to do it correctly, in a correct way. So let's start now. Heels up. So if it's very difficult to actually control the rhythm of second and third exercise, what you can do, you hold your shoulders and you do second and third exercise with inhaling and exhaling, with the correct inhaling and exhaling. So let's try to do that. So now it will be exercises number 5 and number 6. Again, it will be no hyperventilation, no increase in the pulse rate, and first we will do number 5. So your legs needs to be in a different position. One leg goes in front Another leg, you stay on your toes, goes to the back, and you need it for stability. So you don't bend your knee on the back leg, but you bend your knee that is in front. You bend your knee and you close your chest at the same time. And when you close your chest, you do inhale and automatically exhale when your leg is straight. Now you do the same, but with another leg. So you put it in front, you put another leg backwards, and you stay on your toes. So now you will bend this knee, and you will close your chest with a bent knee, and you do inhale. Thank you. So what?
21.
21. And pulse?
No, that's 121.
121. You see, and it's such an easy exercise. Now the exercise number 7. So I call it hand washing. So the position of your legs are aligned to your shoulders and your toes pointed inwards, and you do hand washing. When you bend down and go down towards the floor, you do breathe in or inhale, and when you lift your body a little bit, you do exhale. So let's do like our grandmothers and grandmothers were doing. Let's start the exercise. Now we will start with the exercise number 8. So now your legs will stand differently. So you have to put them apart as much as possible, and you do the same hand washing. So you go down with your torso, and when you go down, you inhale, and when you lift a little bit your torso, do exhale. So let's start. It's a wonderful stretching exercise. Now we are doing the exercise number 9 and number 10. For that, our legs needs to be put in a very, very different position. So you put them apart as much as possible, and then you actually bend your left knee, and with the right hand you try to reach your left heel, and this left hand goes underneath your knee and holds on the inner part of your elbow. While you inhale, you bend your knee a little bit, and when you a little bit release your knee, you do exhale. Let's do it. Now we go straight, and we do the exercise number 10, exactly the same, but on the other leg. So I bend my right knee, I lie on my right knee, I try to reach with my left hand my right heel, and my right hand goes underneath my knee, and I hold inner part of my elbow. And we do the same. Bend your knee and do inhale. Thank you very much. We go straight. Now, how is the pulse?
115.
115. Now we start with the exercise number 11 and 12. Number 11 exercise is very easy, and you will just feel so much better with the muscles of your lower extremities. So you again put your legs as wide as possible. You have to bend your knees and you go backwards at the same time. And with the right hand, you massage your left lobe, including cartilage. And again, with the left hand, you massage the right lobe of your ear, including cartilage. Why cartilage is important? It's a lot of centers, acupuncture centers, for stimulation of breathing, for lymphatic drainage from the tonsils, and also to activate your memory and concentration. So let's run away from Alzheimer. So you massage your lobes and you go backwards, and when you go backwards, you do inhale. Another exercise we're going to show you is number 12. So you keep your legs open as wide as possible. You also bend your knee, but at the same time, you massage your earlobes in the same way. And you bend your knee and you go down, you do sit downs, you do inhale, and you do another inhale when you go straight. Perfect, yeah? Good. Now, the next exercise will be the exercise number 13. So the 13th exercise, for this exercise, you have to keep your legs aligned to your shoulders, maybe a little bit wider, and you have to reach with the right hand your left toes, with the left hand your right toes. Every time you touch your toes, you do inhale. Let's start. Perfect. What about your pulse?
123.
123. But you will see no difference with anaerobic exercises. You see, you're practically doing nothing. And the last aerobic exercise, the last one, is when you embrace yourself. You hold your shoulders and you move your neck in front, to the back, to the right, to the left, clockwise, anti-clockwise. So, and you breathe in and out. Perfect. So that was the last exercise of aerobic section, and now we slowly come to anaerobic section, where you will have a little bit of hyperventilation, you will have a little bit of an increased pulse rate, but don't worry, not more than 140 beats per minute. The first anaerobic exercise are called to wake up. And this is a beautiful exercise if you do it early in the morning, because it can wake you up, it can motivate you more, it can make you strong, it can make you even anti-aged. So it's a little bit the exercise that will take time to learn, but it's a beautiful one, and just repeat what we are doing with Doreen. So you put your legs not aligned to your shoulders, you put them little bit apart, and because it is the first anaerobic breathing, you do much more inhales. So the first inhale, you stand like that, your toes are pointed inwards. The first inhale happens when you bend your knee, you close your chest, and you go towards your floor. So you sit down in between your knees. You do first inhale, exhale, and another inhale when you open your arms, and you have to have 90 degrees in between your arm and your torso, and 90 degrees in between your arm and your palm. So let's do it. Okay. So you go in front, I go a little bit to the back, and then we will not interfere with one and another. Okay. Perfect. How is your pulse?
108.
108. When you were doing that, it was 120.
Oh, yeah.
It's perfect. Anaerobic exercise, and it's exercise number 2. So what do we need to do? We need to have a chair. So the chair, we've got beautiful chairs. We sit down on a chair, on the edge of the chair, and we sit down on our hands covered with our bottom. So these are 2 of my hands under my bottom, and I put my legs, my toes together. I put my toes together, and I keep my legs with a 90 degrees according to my thigh, and I do sit downs in between my knees and a chair. So just make sure that you've got enough of space, and while you're doing sit downs, you inhale first time, a straight up movement, then you exhale. So let's do it. You sit on your hands, and we do exercise number 2. Beautiful exercise. Perfect.
So it was firing more. Heartbeat 127, 28.
It will be not more than 140, I promise you. Now this is exercise number 3, 4, and 5. Why I say 3 and 4 and 5? Because we will do it in a precisely the same position on the chair. So let's do the 3rd one, then gradually the 4th one, and then the 5th one. So let's do the first one. That is called push-ups. So you hold the chair from the opposite sides, and you go backwards on you stay on your toes, and you put your legs as much backwards as possible. When you do push up, you do inhale. When you open your elbows and your arms are going straight, you do another inhale. So 2 inhales, 2 exhales. Okay, let's do it. Number 4, what we do, you put 2 of your elbows onto the chair, and your face is in between your hands, and in between maybe your arms, but you go backwards as much as possible, and you put your toes together, and you prolapse your spine. You do inhale, exhale as you prolapse your spine. Now it will be the 5th anaerobic exercise that we call plank. So you go with your elbows again onto the chair and your face in between your hands, and you stay in the same position and you do inhale and exhale. Let's do that. Maximum legs, maximum to the back. Another anaerobic exercise will be number 6 and number 7. And what we're going to do jumps, but differently. So number 6 is you hold your chair and you just put your toes together and you check your knee. You don't need to have any accident, so your knees needs not to touch your knee, need not to touch your chair. So, and then when you just check your space in between the chair and your knee, you do jump backwards, maximum backwards, and you do inhale. When you jump in front, you do another inhale, and you jump with both legs. Okay. And if you want to relax a little bit, stretch your spine. Stretch your spine and breathe normally as you breathe with inhaling and exhaling with any kind of a physical activity. Another exercise, it's number 7, is also jump. But you jump and you exchange both of your legs. First one, the left leg will be in front, and the second inhale, the right leg will be in front. So let's do it. So you stay with a bent knee and one leg is in front, another one is at the back staying on the toes. And now you exchange your legs and you do breathe in and out. Inhale, 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 inhale. Okay, let's do it. Now it's the exercise number 8. You sit on the edge of your chair, you go in front, you go forward as much as possible, and you lift your tummy and you stay on your heels. When you do push-ups, you do inhale and then you do inhale again when your elbows are straight position. Now we will do the 9th exercise from anaerobic group. So for that, you sit down on the edge of your chair and you sit here and you hold your chair from the opposite side. So you bend your knee, you push up your legs, you straighten your legs, and then you put your legs down, inhale, up, inhale, down, inhale, up, inhale. Lift your legs with a bended knee and then open your legs and do Now we're going to do the 10th exercise from the anaerobic group. For that, you have to put your toes on the chair and you go in front onto your hands and you bend your elbows and you do 2 inhales. When you bend your elbows and when you open them, it's another inhale. And now it's 11th exercise. It's the last one in anaerobic group. We will need 2 chairs and we will do it one after another. So what do you need to do? You do again push-ups, but you do it in between 2 of your chairs. So you sit down on the edge of one chair and you put your heels on another chair, and then you do push-ups. You go down towards the floor and you bend your elbows and you go upwards, and every time you bend your elbows or open your elbows, you do inhale. So it will be again 2 inhales. So let's do it. And I put my heels on the opposite chair, and I am sort of on a two arms are holding me. 2 arms are holding me. So I do a push-ups. When I put my body down, I inhale, and when I put it up, I inhale again. Doreen is sitting on the edge of the chair. She puts her heels on another chair and then she goes down. Now we're going to the last part of our presentation. You need to know what to do when you were in the contact with people with any kind of viral infection, including COVID-19. Prophylactically, and from the point of view of treatment, you have to do the first exercise that we showed to you with Doreen, and you do it 20 times, approximately 3 times per hour. 3 times in 1 hour, yeah? And you do it approximately 20 times, and you do it 3 times in 1 hour. And you do it for the whole day, because this is the viral infection. So the sooner you will stop the viral infection, the better you will feel. So then you close one of your nostrils with the right hand, and you breathe with your left nostril, and you put your hand onto your tummy and you control the diaphragmatic contractions. So breathe in 20 times. Then you stop it, you change your nostril on the left one, and then you continue breathing in the same way. Just remember, your hands, your legs need to be aligned to your shoulders, and your toes needs to be pointed inwards. So let's start. I close the right nostril with my index finger. So let's do it. Now we change the nostril. We close with our left hand, we close with the index finger, the left nostril, and we continue breathing for 20 times. Thank you. So you have to do it for 3-4 days frequently, like you repeat several times, breathing with one nostril and then with another one 20 times. Why? Because you have to suppress the activity of the virus. So now it's a very important question. How do we count the breathing exercises? So to count it, you have to remember 1 inhale and 1 exhale is a 1 breathing exercise. So when you do a breathing, and you have to count how many exercises you do in during one breathing exercise. So to control it and to count it correctly, you have to do 20 breathing and you bend one of your fingers. Then you do another 20 breathing and you bend another finger, and you do it 5 times. So 5 multiplied by 20 means 100. So to be successful with vital energy diaphragmatic breathing technique, you have to do approximately 100 breathing of aerobic part of the exercises, and you have to do from 20 to 60 of anaerobic. Don't push yourself from the very beginning. Start slowly. If it's difficult, make it 50 times. Aerobic exercises. Make it 10 times. Anaerobic exercises. And slowly increase the amount of breathing. So don't push yourself. Go slowly from 10 or even 5 to 20 to 30, and if it's anaerobic exercise, you do not more than 60. If it's aerobic exercises, you do 100 or 200s. What does it mean, 200? 2 hands with the bent fingers. And now we finish our program for today. I want to say thank you very much for your attention. I want to ask you, please do these exercises. Maybe not every day, maybe every second day, but do repeat them. And I promise you, in 1 month's time, you will feel so much better, so much stronger, so much happier, so much anti-aged, and less dependent on pharmaceutical business. Thank you very much again, and our lessons are over. And the end of our video, of our presentation of diaphragmatic breathing vital energy technique, I would like to say thank you to all our team. This is Doreen Nell. I will repeat, my friend and my patient, and absolutely wonderful lady and very talented lady, as she learned how to do these exercises in such a short way, and I'm very, very proud of her. I want to introduce you to Derek Nell, who is one of the owners of this beautiful place where we made a video, and we are very, very grateful to him for that. And I want to introduce you to Vani Richter, who is our video man or cameraman, and thank you for such a beautiful quality work. We're very, very grateful to you. And Derek Terry, this is my business partner and also my partner in all my crazy and not so crazy ideas. Also, thank you to follow me. Thank you very much. And I'm not saying goodbye, as our next video will be vital energy diaphragmatic exercises for kids and for children. Thank you very much, and bye-bye.